The Positive Pause is a motivational-minded podcast covering topics women want to know about as they journey to and through menopause, focusing on subjects that impact women's health and healthy aging, including what it means to age healthfully. The Positive Pause features experts and influencers from a variety of industries and specialties. The information and opinions expressed on the Positive Pause are not intended to replace the services of trained professionals or to provide specific medical advice. To see the National Menopause Foundation's full medical disclaimer, please visit nationalmenopausefoundation.org.
Welcome to the Positive Pause. I'm Claire Gill, founder and CEO of the National Menopause Foundation. In this episode, we talk about osteoporosis, bone health, and menopause. With me today is my colleague and board member, Susan Randall. Susan Randall is a nurse practitioner who has worked in women's health for over 30 years. Susan was my colleague at the National Osteoporosis Foundation. Today, we'd like to give you information about what you need to know about your bone health at menopause. Thanks for being here with me, Susan. We're going to be talking about osteoporosis, bone health, and menopause. So I appreciate you joining me.
Thank you, Claire. Happy to be here.
So let's talk a little bit just about what is osteoporosis.
Osteoporosis is a condition where the bones become weak and more prone to breaking. The cause can be from a number of different things, but the most common cause that we see is due to a loss of estrogen that is most commonly associated with menopause.
So that's why it becomes much more of an issue for us at midlife than it is, say, when we're in our 30s or 40s.
Right. For most women, our peak bone mass is achieved around the age of 30. And the bone health stays stable for between like 30 and the onset of menopause. And then it slowly starts to decline, and that is associated with a decline in estrogen. So it slowly tapers down. The first 5 to 7 years after the onset of menopause is the point where bone density decreases the most rapidly. Some women can lose up to 20% of their bone mass in those first 5 to 7 years. Then it levels out and continues to decline until the end of life. So we do get concerned about bone loss at menopause because of the loss of estrogen.
Interesting. Obviously, women have the loss of estrogen at menopause, but osteoporosis doesn't just happen in women, so it happens in men too, right?
It happens in men.
What are the other risk factors then that would happen for both women and men?
Before I talk about both genders, let me talk about another condition, and that is amenorrhea in women. When women have long periods of time during their life when they do not have a period, a menstrual period, and that sometimes happens or frequently happens with eating disorders, which are actually fairly common, that can impact the bone density too.
Well, I remember
in a negative
high school,
way.
a little bit too much information, but I remember in high school playing sports, I could go a couple months without a period.
Right.
I used to look forward to those times, I have to say, but that actually wasn't good for my bone.
Sure, right, exactly. Because the body it needs that estrogen to promote good, healthy bone development.
But that's not so obviously people with eating disorders would be at a higher risk for osteoporosis later in life. I would say women athletes who do a kind of extreme sports might do it. But your average woman, like we said, we've all probably, I don't know there's any woman who hasn't skipped some periods in their lives. That kind of intermittent isn't serious. It's not really serious for bone loss until we've actually stopped having menses.
Well, younger people can get osteoporosis that are premenopausal women can. I mean, they could have premature ovarian function disorders.
Okay.
So when they're, premature menopause.
Okay.
So it doesn't always happen at midlife, and the most common age for the onset of menopause in the U.S. is 52. 51, 52. But some women go through menopause or begin menopause at much earlier ages, and sometimes even in the 30s. And there's various reasons for that that I don't think we need to go into. But the significant piece is that anytime a period stops, when you're not expecting it to stop, and it's longer than a month or two, you should talk that over with your physician.
Okay. So let's talk a little bit more about other risk factors. So we know for a woman as she approaches menopause, or she should be concerned about bone health. What are some of the other things that would lead women to pay attention to their bone health?
There are some medications that people can take that are really damaging to bone, but that are necessary to take for different health conditions. So the biggest one, the most significant one, is corticosteroid medications, drugs like prednisone, that's given for certain conditions.
Autoimmune diseases, right?
Autoimmune diseases. It's used for rheumatoid arthritis. It's used for sometimes severe asthma and other pulmonary diseases. So if someone is on a long course of corticosteroid therapy, then that can significantly negatively impact bone. Now, we're not talking about a dose pack, something like that for poison ivy. That's not what we're talking about. We're talking about months of therapy can damage the
bones.
bones.
You said, really, because it's necessary to treat something else that we need.
Right,
yeah.
Right.
And what about body size and frame? Does that impact whether or not we have osteoporosis?
It does. Interestingly enough, women who have a small body frame, women who are very petite or have a low body weight, and the literature says less than 127 pounds, but that's not an absolute number. It has more to do with the size and the heaviness of the skeleton. So if someone has very petite bones, you can think about a woman who is 5'1" and weighs 110 pounds, which is, normal or on the high side of normal for someone of that height. Her bones are significantly different from someone who is 5'10" and weighs 180 pounds.
Right.
I mean, that's really different. Their bones are heavier. They have more mass in their bones. So really, when we're talking about osteoporosis and bone loss, we're talking about the mass of the bone decreasing to a certain level where the bones become even more fragile.
Now, I know from our work together on osteoporosis that it's really the importance of bone health extends throughout the lifespan. But given that we're really talking to our audience here for the Positive Pause is that menopausal women, let's just focus on that for this discussion about, so what do women do now? So we start to lose bone, lifestyle changes, diet, exercise. What are the recommendations for women as they come into menopause to start protecting their bones?
Sure. I think the biggest message to tell women is that midlife is a time of opportunity. Many women are really taking a good assessment of their health, as of their life and their habits in all aspects of their life. Their children are older. They want to travel. They want to do things. They're looking at, okay, what do I do with the next half of life? So it's an opportunity really to take a look at what your health is now and what you want it to be and what do you need to do to sustain your health so that you're able to do all the things that you want to do. You want to travel, you want to be there for your grandchildren and chase them around and pick them up and do all those things. Some of those activities are going to be limited if you have weak bones, prone to fractures. So some of the things that you can do are really take an assessment of your bone health. Since we're focusing on bone health, there's a lot of things that women need to focus on in midlife, but this is one of them. Take a look at what your risk factors are for developing osteoporosis. Certainly, if you have a first-degree family member who has had a broken bone before the age of 50, that is significant. Mm-hmm. Or any broken bones, you should have a conversation with your physician about your personal risk to develop osteoporosis. And that is one of the biggest risk factors, is if you have a relative, a first-degree relative who has is it
a genetic
fracture.
Or is it just hereditary?
It is genetic. And about 1 in 2 women over the age of 50 will have a broken bone due to osteoporosis in her remaining lifetime. So it is a significant cause of morbidity and mortality among women. So the appropriate time to focus on this is, if you haven't thought about it before, is in midlife. So we want to limit as many risks as we can. We want to assess those risks and then make a plan going forward. How can we keep our bones strong and healthy?
And to do that, what are the recommendations for nutrition and exercise for bone health?
Okay, everyone needs a certain amount of calcium and vitamin D every day to keep their body functioning. Vitamin D is an essential nutrient for bone health. It also helps with many other conditions, many other functions in the body. A woman age 50 and older needs 400 to 800 international units of vitamin D a day. People say, well, what about sunshine? And it is true that the sun will, sun exposure without sunscreen will help convert vitamin D, sunlight, into vitamin D that can be used by the body. The downside of that is we can't quantify it. And so many people are using sunscreens now, especially women using sunscreens on their face, which is the most available part of the body.
The most exposed.
Sure,
Yeah.
the most exposed part of the body to sunshine. So the use of sunscreen makes it even less likely that you're going to get
But
enough
that's
sun.
important. So we need
Right.
the sunscreen. So we got to get
Yeah,
it from
you
somewhere
got
else.
it. You need right. So if you're not getting it from sun, then you need to get it in a supplement. And so vitamin D supplements come in vitamin D2 and vitamin D3. Most probably you're going to encounter vitamin D3, and that is the form of vitamin D that's most readily used in the body. However, D2 will be converted into D3 and is usable as well. So it doesn't matter which one you take.
And then what about calcium?
A lot of women know about calcium. And calcium is essential. It's not just needed for bone health. It's also needed for nerve conduction, for blood clotting, for proper muscle contraction, including the heart muscle. The heart is a muscle, so that needs to keep contracting, and calcium helps that. Now, what the experts recommend is that you start with your food first, assessing whether you're getting enough calcium every day. A woman aged 50 and older needs 1,200 milligrams of calcium a day from all sources. A woman under age 50 needs 1,000 milligrams a day from all sources. So that includes your food and any supplements that you take. So let's talk about food first.
Yep.
All right. Foods that are high in calcium include dairy foods, low-fat milk, low-fat cheese, low-fat yogurt are all excellent sources. Not everyone can tolerate milk or dairy products, so they're going to be a little more, most likely, a little more dependent on supplements. But I want to stress caution when it comes to things like coconut milk and soy milk and
like everything seems to be
almond
supplemented
milk
with
and
vitamin
all
D
that
and
stuff.
calcium.
You have to look at the label for those alternate sources to see how much calcium has been added into those. Not everything has added calcium, so you need to look at that if you're using that as a substitute for dairy milk.
Okay.
All right. And so other sources include fortified foods. Most notably, the easiest ones I think to find are fortified orange juice, fortified breakfast cereals. Another source would be dark green leafy vegetables like broccoli, bok choy, those types. Kale is high.
So generally, though, again, if we're sort of eating a well-balanced diet, we're getting from the different food groups, we should be able to get the calcium we need from our diet.
Sure. But the best, what's recommended is 3 servings of dairy a day.
Right.
And I don't know, not everybody does that. I don't know of a lot of people who do that these days. People are concerned about weight gain. And so one of the first things that goes is dairy foods.
That's true.
Because the perception that they're high in fat. So if you're not getting enough calcium from your diet, then you need to think about adding a supplement. And what I personally do is I start with my food every day. I have in my mind how many dairy products I have a day, how many other foods I take. And then if I need a supplement, then I take a supplement to add up to the amount that I need.
Yeah, so we're going for that 1,200.
For that 1,200 milligrams
ideal.
a day.
Then if you had a yogurt that has, let's say, 200 milligrams and cheese that has 200 milligrams, you're going to deduct those from 1,200 then and just supplement for the rest.
Right.
And can you get the supplements in those smaller doses?
Let's talk about that. Some of the calcium, there are a million different calcium supplements out there. The most common ones you're going to see are calcium carbonate and calcium citrate. Calcium carbonate needs to be taken with meals, because when we eat, our stomach creates hydrochloric acid, which helps to dissolve the calcium tablets. Calcium citrate doesn't have that exclusion. So calcium citrate can be taken any time of the day. But you want to try not to have more than 500 milligrams of calcium at a time, because that is about all that the body can handle. If not that it's going to do anything negative to you,
Right.
it might make you constipated perhaps, but it's going to just pass through and be eliminated.
It doesn't do
from
its
the
job.
body.
It doesn't do what
It
we're
doesn't
taking
do
it
what
for.
you're
Yeah.
right. It won't do you any good to take 1,000 milligrams of calcium at one time. It's just not going to do it, because the body's going to use
Reject
up
it.
to 500 and excrete the rest. So you're just flushing money down the toilet. But you want to divide it out through the day. You want to look at your multivitamins, because many multivitamins, if you're taking a multivitamin, will have some calcium on it. So you're going to look and you're going to see that, okay, this brand of multivitamins has 200 milligrams in it. Okay, you're taking a multivitamin, so you got 200 out of that 1,200.
Mm-hmm.
And you have a cup of milk with the fortified cereal for breakfast in the morning. And maybe you'll have yogurt in the afternoon for a snack. And maybe you'll have broccoli with your dinner, and have an orange. Believe it or not, a navel orange has about 60 milligrams of calcium in it.
Oh, cool.
So, before you know it, you're hitting up against the amount that you need. So the National Osteoporosis Foundation, on its website, www.nof.org, does have a calcium calculator on the website that you can use to learn how to estimate your calcium intake.
So what happens if I go over, right? And I end up getting 2,000 milligrams of calcium between over supplementing or having more in my diet. We've talked about, there's been a lot of stuff in the news about, calcium supplementation is so bad for you. What happens if you go over that 1,200?
Well, sometimes you do go over. And if you do that occasionally, that's probably not much of a problem. But like I said before, you're probably going to excrete some of it if you're taking too many supplements. But there is concern that if you take too much calcium in the form of a supplement, that is seen, it's called a bolus in medical terms, to the body. So it's a large amount all at once, as opposed to food, which is digested slowly and absorbed slowly into the system. So food is a preferred source, and it's so you want to get it from food if you can. Right. But then if you take it, the thing is, we are concerned that extra calcium may be stored in blood vessels as calcification. So we want to try to encourage people to get their calcium from food and only supplement the amount that's meets the shortfall.
But the importance of us actually getting to that 1,200 is key, right? So it's better to get to the 1,200 even if you have to supplement with it, because you need that 1,200, right?
But I've talked to many women who are like deathly afraid of osteoporosis, and are eating a high calcium diet, but also taking 1,000 to 1,200 milligrams of calcium in the form of supplements, and that's overkill. You really don't need to do that. It's not doing you the good that you're hoping it will.
Okay, right. So just to the amount that you need, not over.
More is not necessarily better.
Right, and so that's kind of simple, though, right? We need calcium and vitamin D and again, I know a well-rounded diet also, fruits, vegetables, the same we do for every kind of healthy disease state. So let's talk a little bit about exercise, because again, something that changes for women at menopause. If you've been exercising on a regular basis, you sometimes don't get the same benefit of that exercise. You have to change up your routine a little bit, as we heard in our last podcast about exercise and menopause. But then there's some certain exercises that are better for building bone than others, right? We have cardiovascular, and then we have others. So talk a little bit about what kind of exercise we need to build bone, to maintain our bone.
Okay. Well, First of all, I like to call it physical activity because it sounds less scary than exercise.
Right.
Okay?
Right.
So we're going to talk about physical activity, which everyone needs. And physical activity benefits every part of the body, okay? It benefits our bones. It benefits our cardiovascular system. It benefits our psyche. It helps burn off stress and anxiety. And so, and many other, it helps digestion, helps our respiratory system. So physical activity is essential. So we got that out of the way. Now, let's talk about what's best, the best kinds of activities. You want to look at what your pattern is, and maybe you're very sedentary. You work at a desk in an office and you're not really getting much activity other than, just what you get in the course of doing your activities of daily living. Well, what we strive for is to have 30 minutes of exercise, physical activity, 5 to 7 days a week, okay? That would be physical activity. On top of that, you're going to want to do some resistance exercises to keep your muscles strong. And you're going to want to stay flexible. So you're going to want to have some functional exercises that help you stretch your muscles, keep yourself limber. Okay. So the physical activity in the form of walking, aerobics, aerobic dance, Zumba,
like dancing around my kitchen?
Dancing around your kitchen does count. Jumping up and down with grandkids, that counts. Or children, it helps. Chasing the dog.
Yep.
All that counts. So it doesn't have to be 30 minutes all in one time. It can be broken down into 10-minute intervals. But you want to strive to get 30 minutes of good, vigorous exercise 5 to 7 days a week. So the next kind is resistance activities. We want to get resistance exercises. These are also called strength. It's also called strength training. And you get that by using resistance bands or lifting weights, other activities that use your body as weights, such as doing squats, or doing planks. Mm-hmm. Those are using your own body to do that resistance training. Those help build the muscles, keep the muscles strong. And you want that because we need to be able to lift things, move things.
Support the skeleton,
Support the skeleton, support the body. It keeps us standing upright. And then the functional exercises are things like posture exercises that help us stay erect. The functional exercises will be stretching to keep our joints and muscles limber.
Sort of like yoga and Pilates.
Pilates could be Tai Chi. That all helps with balance. And if we don't keep our balance, our physical balance, then we're more likely to fall. And what I would like people to take away from this is that the majority of fractures from osteoporosis are due to falls. So if you don't fall, you're much less likely to get a fracture. Not that it can't happen, but you're much less likely.
I was going to say, I think most people think that they wouldn't break a bone unless they fall. But, there are circumstances where people have sneezed or gotten even a soft hug and they had such severe osteoporosis that it broke bones.
Right.
But when we talk about, again, for the normal population, a fall from a standing height that makes you break a bone is considered an osteoporotic fracture, right?
Correct. It's considered an osteoporotic fracture.
We've had many people, even my mom, said when she broke her hip, "Oh, I just tripped over that cord, and it was just, it was just because I tripped. It didn't have anything to do with osteoporosis. I just fell. I tripped." But that's not the case, right? Yes, there was a fall, but they shouldn't have broken the bone.
Right. If a person falls from a standing height, you should be able to withstand that without a fracture, without a broken bone. You might get bruised, you might scrape the skin, but you shouldn't break a bone. So if you break a bone, that's abnormal. We consider that organ failure.
So I've had friends, though, who, fell on an icy sidewalk and broke a wrist. So we're saying that kind of fracture should not happen unless your bones have potentially low bone mass.
Correct.
Okay.
Correct. And so a woman or anyone who has a wrist fracture who falls, and it's normal to want to brace your fall by putting your hands out in front of you if you trip. But if you break a bone doing that, you should follow that up with a bone density test, which will determine how much bone mass you actually have.
Okay, so that
because
wasn't even
it wouldn't necessarily be osteoporosis, but it could be. And if you find out you have osteoporosis at the time that you have a fractured wrist, then you may not go on undiagnosed, untreated, to develop broken bones in your spine, vertebral fractures, or later on, a broken hip. So
let's talk a little bit about how you get diagnosed, right? So let's keep with the woman who's fractured. So I'm 50, I trip on a sidewalk, I stumble, I fall, I break my wrist. I get the wrist patched up at the emergency room. Are they going to send me for a test to check my bone density, or do I have to go somewhere else?
They could, but the most likely scenario is that they will say, oh, great, you're healing fine, and, that's it. But what you should do after that is, you'll follow up with your orthopedic surgeon, but you also need to follow up with your primary care practitioner and explain to them that you had this fracture and ask for a bone density test.
And then what happens with a bone density test? Let's talk a little bit about the test, because it's kind of the gold standard on being able to diagnose osteoporosis, and it's not nearly as complicated as mammograms or colonoscopies that we have to do at this time of life. So talk a little bit about what a bone density test is.
A bone density test is probably the easiest test that anyone can get. They don't even stick you with anything. So you'll change into a gown in an x-ray, and many women get this done in conjunction with their mammograms, but you'll change into a gown and you'll lay on an x-ray table, and they'll take pictures, although they're like an x-ray, but they're very low radiation.
Okay.
And they'll take pictures of your hip and of your spine and possibly your forearm, and then you get up and you get dressed.
You get a sort of like a number, right?
You'll get a reading after that and a report from the imaging center, and they'll give you a number, and that will be your T-score. So T-scores are a representation of the degree to which the person's bone mass varies from average. It's dependent on age. And so it's presented also in standard deviations, which is, if anyone has ever taken statistics, that's you should know what a standard deviation is. But the vast number of people don't know that. But you'll get a reading, and it's usually between 0 and a minus number. And so people sometimes get thrown with minus numbers.
Yeah.
But it's really minus numbers, because on the plus side, those are people who have abnormally high bone density.
Okay.
And
so 0 is the equilibrium. Everything's right. If you're minus 0.1, point whatever.
Well, if you're minus 1.0 to minus 2.5, we consider that osteopenia, meaning low bone mass.
Okay.
Minus 2.5 or greater, which is minus 2.7, minus 3, minus 4 even, is low.
That's full osteoporosis.
That's full osteoporosis.
Okay.
However, people who have had a broken bone, and not counting fingers, toes, and skull, and have a minus 1 to minus 1.5 or something like that. That would be osteoporosis.
That was it. She broke her hip, but her bone density exam, also called a DEXA, DXA is what it's abbreviated. So you might see that in some literature. But she only had osteopenia as low bone mass, but she met the osteoporosis crisis because she had broken so many bones when she fell. So so the DEXA is just one part of it. The bone density test is one part of it. And then again, if you fractured and how many times you fractured really determines how severe your potential osteoporosis is.
Right. And again, your mom was very petite. She was small and had small bones. So you would expect that her bone density, her bone mass measurement would be on the low side. So it's not perfect, but it is more predictive of osteoporosis than a cholesterol test is predictive of a heart attack. So it's very specific for bone density. Right. So it's a very good test.
So we've talked about women who fractured and then again, probably have to request the bone density test, because it might, even though they bring it up to their primary care physician, the primary care physician might not say anything about it. My mom's primary care didn't, I didn't, but if you don't break a bone at midlife or around menopause, what should women do to test whether or not, do they get a bone density test too? Should they ask their doctor for it?
Any woman who's age 65 or older should have a bone density test.
Okay.
However, if someone who is 50 or older and has any of the risk factors for osteoporosis, maybe you have a first-degree relative who had a fracture, you should be tested to see what your bone density is going into menopause.
So like getting a baseline.
It's
right?
getting a baseline. Now, there's a lot of controversy about whether everybody who's starting menopause should have a DEXA, and there isn't uniform recommendations on that. So thus, consequently, many insurances won't cover it. So it doesn't mean that you can't have one. It means that your insurance might not pay for it if you're younger and you don't meet the standards.
If we want to do a baseline.
Right.
But if we have risk factors, so again, we'll use an example. My mother had hip fractures. She's had vertebral fractures. She did all of these things. I should be able to say to my doctor, based on my mother's risk factors, or my grandmother's in many cases.
They're your risk factors.
They become my risk
factors.
They're
your risk
and
factors.
I would like to get a bone density test. That likely, because I am considered at risk for osteoporosis, will be covered by health insurance.
Another thing that I advise women at midlife to do is get their height measured.
Why is that?
Because later in life, if you want to be able to know if you're having a spine fracture. And believe it or not, people can break bones in their spine and not have any discomfort. So you may not know. You might recognize it by your pant legs, touching the floor, being, they used to not sag to the floor and now they're sagging to the floor, or your adult children now seem taller.
But we think that just is like aging, right? We all shrink.
We all shrink. And, that's not, while it might be true, it may not be for average, non-significant reasons.
Well, what's there's normal height loss as we age, right? As we say, we shrink a little bit. But what is it? What, over an inch of height?
An inch and a half.
Inch and a half.
Yes, from your peak height, which usually is in your 30s. But
so same thing. We always laugh about how as children we grow up and we try to be as tall as our parent, and then you sometimes surpass the parent and all of that kind of stuff, whatever. But I remember my mom being 5'7". That's what her driver's license said. But certainly at the end of her life, she was 5'4". But no, perfect posture, perfect everything, where she didn't have the curvature of the spine that sometimes comes with osteoporosis, but she'd broken so many vertebrae that she just kept losing height. But it was even a shock to her when, she was, measured, as you said, to say, hey, you've lost 3 inches of height. That is not normal aging. That there's another cause for that.
And I think it's normal when people ask you, how tall are you? You revert back to when you got your driver's license. Right. You say, oh, well, I'm 5, I've been telling people I'm 5'2". The fact that I'm 5'1.5" was devastating to me. But I know I don't have osteoporosis, but I don't want to be any shorter than I am. So I can't imagine if one day I got measured and I was 5 foot or 4'10", which has happened. People have lost 6 inches of height overnight from collapsed vertebrae.
Wow.
And that is a collapsed vertebrae, or another type of fracture that people with osteoporosis are very prone to, untreated osteoporosis.
Right. That's really interesting. So, like you said, one of the really simple things we can do as we approach menopause is just take a height. Like I said, I say I'm the same height as I was when I was playing basketball in high school. That was my given height. Then you cared. You wanted to be as tall as you possibly could, so people did your height. But a good baseline would be, how tall are we now at 50? And then keeping track of that as we age, right?
Right. Now, as we get older, the discs that are between the bones and the spine, they do dry out a little bit and they do compress, but that shouldn't amount to more than 1.5 inches.
Okay. So that's the thing, as
and
we
age,
keeping track that we don't lose more than 1.5 inches of height.
Right.
And again, if we do, then talk with our doctor about that.
About a DEXA, right.
Right.
Mm-hmm.
Okay.
And they could do specific imaging on the spine called a vertebral fracture assessment that actually looks in detail at those bones in the spine.
So there's, again, lots that we need to know about osteoporosis, but if half of all women will have a fracture in their lifetime based on their bone mass and osteoporosis, then this is really when we worry about heart disease and breast cancer as we age, certainly dementia, all of these things are such crisis concerns for us, I think, as we start to approach midlife and wonder, how do I stay healthy? But one of the really most important and the most impactful might be our bone health and doing something about that.
It's our bones and our skeleton that gives us the ability to engage with our environment, engage with our family, keep us walking and functioning as fully functional people in our society. And so if you lose that, you lose a great deal of your identity and connection with people. It can lead to depression and isolation. Right. So it really is important.
Yeah. That's something, and it's just a great thing that we can do and take stock of and start to make changes to help improve our overall health. So, Susan, you did this great webinar for us that's now posted on the National Menopause Foundation website that goes into a lot more detail about this, about how peak bone mass is formed, how our bones form, all of that great stuff. So I just want to direct our listeners to be able to get more information about it. You already referenced that the National Osteoporosis Foundation, which we both used to work for, has fantastic information on nof.org. Are there other sources of places that you would direct people?
There are. The National Institutes of Health has the National Institute NIAMS, NIAMS. That's their bone section of NIH, and they have some great resources. The National Institute on Aging has resources. They have a program called Go for Life, which is all focused on physical activity for adults as they age. And also the Centers for Disease Control and Prevention has a program called STEADI, STEADI, which focuses on fall prevention.
Well, thank you so much for this. Truly informative. I know there's a lot of other things we could cover on this, but again, the webinar that we did on osteoporosis and bone health, I got you menopause and bone health, what you need to know, has a lot of great information in it, and I appreciate your time on this.
Thank you.
Thanks so much, Susan, for joining me for this episode of The Positive Pause. I think we covered a lot of information today. If you would like more information about osteoporosis and bone health, we have a webinar that Susan did that's on our website at www.nationalmenopausefoundation.org. It's under the education section, and it'll tell you even more about what happens to our bodies and how we change at menopause. Thanks again for being here. We look forward to having you join us for the next episode.